My name is Denis Nash. I'm an epidemiologist and professor at the CUNY School of Public Health at Hunter College. My area of specialization has been in infectious diseases and specifically HIV and AIDS. I've worked on HIV and AIDS both domestically and internationally, and my recent work has focused on HIV and AIDS in sub-Saharan Africa. The project I'm currently working on has to do with the scale-up of HIV and AIDS treatment in sub-Saharan Africa, which is a relatively recent development. It took nearly 10 years after treatment became available here in the US for it to become available in areas like sub-Saharan Africa, where where the epidemic has hit the hardest. But since 2004, the international community has begun to provide resources, both financial and technical, to begin to provide life-saving antiretroviral therapies for people with HIV. This has resulted in a massive scale-up of treatment services with 100,000 people on therapy in 2004, and has since reached over 4 million people who are receiving these therapies now who wouldn't have otherwise had them. In the process of this scale-up work, we've also been conducting research in order to help optimize the way that HIV treatment programs are rolled out so that they can reach the most people in the most effective manner. My project, entitled Multi-Level Determinants of Late Treatment Initiation in Sub-Saharan Africa, addresses the problem that has been very common in the region, that people tend to start treatment very late in the course of their HIV disease, and they're very sick when at the time they start treatment. As a result, somewhere between 10 and 25% of people who start treatment die within a year. We're looking at whether or not there are, we're conducting studies to help identify some of the important factors that influence the timing of treatment initiation in the region. And in order to help identify better ways to roll out treatment programs to minimize this problem. The expected outcomes is that we would identify interventions that can improve the life expectancy of people who start treatment in the region. And also importantly, when people start earlier, it's better for themselves. And we've also recently learned from other research that when people start HIV treatment, they can reduce the risk of transmitting their HIV infection to others. So starting treatment early after infection occurs is good for both the individual and for public health. The most interesting and illuminating experience for me has been how much of the work in sub-Saharan Africa is relevant to the work that we do here in the US around HIV and AIDS. So I've spent a lot of my time there learning about new ways to implement HIV programs that we haven't thought of here, even though we've been doing them here as well. And so there's a lot of cross-fertilization, and my work has taken me back and forth to sub-Saharan Africa and the US, and there's been a lot of ideas going back and forth as well, and I think that's been among the most interesting part of the work. I like the fact that I collaborate with many different people from different cultures and from different perspectives. I work with physicians, I work with nurses, I work with other epidemiologists and statisticians and economists. So it's very, and administrators and government officials, politicians. It's a very multidisciplinary perspective that comes to bear on the research.